Thank you for being here today. This is our May Mental Wellness Social. Today's topic is on worry and anxiety and using evidence-based strategies to help kids and adults and caregivers. We're very fortunate today to have Dr. Erin Berman, clinical psychologist from National Institute of Mental Health. She'll be sharing her presentation and helping answer any questions and guiding our conversation during our time today. So you can ask questions during the chat during her presentation, and we'll be monitoring those questions, but we'll also have a time after her presentation as well to have a conversation about worry and anxiety. Just a little bit about the Children's Mental Health Matters campaign. It is a campaign that is coordinated by both the Mental Health Association of Maryland and the Maryland Coalition of Families. And if you have any questions or would like to learn more, you can reach out to the campaign coordinators here. Here are their email addresses. If you want to learn more and get connected, the website is here. It's childrensmentalhealthmatters.org. We're just coming off of the heels of Children's Mental Health Awareness Week. It was a great and exciting time across the state of Maryland. It is Mental Health Month, so there's still plenty of ways to get involved. You can take a look at the calendar on our website and find some ways to get involved across your community this month. You can follow us on all of our social media platforms to stay involved as well. Just a few gentle reminders for our time together today to go ahead and make sure that your microphone is muted so we don't pick up any background noises or hear your cute dogs or anything like that. We'd love to see them on screen though, just not hear them. We are recording this presentation today so that we can send it out to you afterwards and you can catch on anything that you missed. We will send that out, like I said, to everyone who's registered, or you can find it on our website afterwards. We'll have that posted next week, and we will have that group Q&A and conversation afterward the presentation today. So without further ado, I will stop sharing and pass it over to Dr. Berman and let her introduce herself and share a little bit more about her work at NIMH.
Excellent. Good morning. I'm going to give me 1 second to get my screen shared, and then I'll introduce myself. So thank you all for coming. This is such an important topic and one that obviously, is really, a place where we can do a lot of good with interventions. There's a lot of really helpful interventions that do target anxiety symptoms. And I'm glad that you guys are all here, that we can speak about this. So let's get this from the start and we're ready to go. So yes, I'm Dr. Erin Berman. I work at the National Institute of Mental Health in Bethesda, Maryland. I am a clinical psychologist, and my primary area of expertise and work is in child and adolescent anxiety disorders. Also, I do have to always kind of disclose that I do not have any relevant conflicts of interest. So let's get started. So the first slide is an image or images, and why I always like to put this as my first slide is every buddy that had, well, number one, we all have some level of anxiety, right? But two, the most important thing is it looks different in everybody. It presents it different in everybody. And, some kids may be really open, these images are showing, kids open to talking about their anxiety. But on the flip side, they may share with parents, they may share with a counselor, they may only share on their phone. And a lot of kids will share with friends, but also only in their head. Anxiety disorders are in the broad category of internalizing disorders. And when that kind of, in one simple sentence, alludes to the fact that what's going on, what they're feeling, the intense emotions are more internal to their body versus, so you're less likely to see behaviors with this. You're more likely to have more thoughts, ruminations, intense feelings that are sometimes less shared. So I do always want to make the point that it looks different in everyone, and to really pay attention to your child's behaviors, I guess, is where you can, and just changes in facial expressions, how they feel, and be sensitive to who they are. As I always say, when I start out any therapy relationship with any of the children and adolescents I work with, is we are never here to change you or who you are. We always want to honor the child, their preferences, their likes, dislikes, but what actually my job will be, and what your job can be as a parent or caregiver or another professional, is to allow the individual to live more freely and not let anxiety decide what they do, and also hopefully take it down a notch how strong the anxiety feels. So this is a more recent data from the CDC to show by age group what you're more likely to see in terms of depression, anxiety, and behavior disorders. So when we speak of depression, we're talking about feeling sad, feeling slow, kind of having inattention, and this is usually something that's prolonged. So not just a day or 2 days, or even a week. It's usually a few weeks of kind of constant symptoms of sadness or kind of low energy. And as we can see, we have there's a small number, very tiny, of little bitty ones that have it. The 6 to 11-year-olds, you're going to see less than 2%. And again, what you'll see here is obviously throughout, there's an increased risk. So just to make you aware kind of where you'll see at different ages. Anxiety is obviously, as you can kind of see in general, the more prevalent disorder across the younger years, and actually the same in adult years as well. Little bit, still under 2% for the 3 to 5s, over 6% for the 6 to 11-year-olds, so not uncommon, and then getting really much more common during adolescence, right? And then behavior disorders, we're talking about oppositional behaviors. And as you can see, the little ones definitely have a little more oppositional behaviors. You could see those middle years can be challenging. And then as they get older, it goes down, or attention deficit hyperactivity disorder. So just generally, you can see the prevalence and how it differs by age. This slide to me is very relevant and very helpful. Why in general? Because it helps you understand your kids, right? So what we know is that children and adults, but mostly by the age of 25, your brain is pretty solidly developed in these areas. But why this is important, and why this relates to anxiety disorders in particular, but also relates to depression and ADHD, is how do we help children and adolescents deal with anxiety, right? Well, as adults, hopefully we start to learn how to talk back to anxiety, or how to control our behavior, or to think things through in general, right? But as kids, when they're little, look at that 5-year-old brain, and the front part of the brain is only a little bit developed. And you can think about that if you think back to working with any 5-year-old, or having a relative or your own child at 5 is very different than your teen child. And what takes the most time to develop is our executive functioning, the front part of our brain, the prefrontal cortex, which we use to kind of control things, right? As you can see on this slide, it's known to work for planning, prioritizing, controlling impulses, and rational thought. So what we can do as parents or caregivers is start to help cultivate these skills that we as adults have a little bit more in an innate way. But there's definitely ways that we can start to cultivate it. So one would be, and many of us do this when we had our little 5-year-olds or preteens, is helping them slow down or control your impulses. I don't know how many times I might say that to my kids: slow down, take a breath. That's not natural for them. It is more natural for us because we have this front of our brain that can kind of slow things down, that helps us control. But kids, adolescents, and as we know, the teen brain becomes very impulsive, right? It takes some real work to kick that in. It's not natural. And I guess one thing that really helps is knowing this and having this awareness. One, can take our expectations down a little bit as parents. They're not little adults. And 2, can help us figure out what skills maybe we want to cultivate in our kids. Okay, great. Neuroplasticity. So what's also neat, and what I was kind of speaking to by looking at there is development, the brain development that changes throughout time, is what that change. Since it changes, this is great. there are ways that we can help them grow these connections and be aware of them. More that also kind of coincides with this development is reward sensitivity, right? So kids really, in general, respond well to positive things, as we know. If they get a toy or they get a candy or they get to go play with their friends or they get to do that dance class or play soccer, right? And be aware that there is a kind of a push-pull of sensitivity at all these ages. And when we're feeling anxious or stressed, it's hard to kind of foster those emotions. So if nothing else, even when a child is feeling anxious or stressed, figuring out how to start to foster more positive emotions after those events can be helpful. What is really important is not to ignore that the child is anxious. I would never say that, like, oh, just be happy. That is not what I'm saying with the reward sensitivity. It's just starting to know that these are a couple different ways that we can start to help kids deal with it. They tend to respond well to positivity. So how can we help them feel positive or a little bit more neutral emotions when anxious things or tough times happen? Be very aware as a parent, caregiver, or professional that it is very difficult at these ages for them to see the whole picture of their behaviors. We know this specifically in teens where they might do something that seems a little off or a little different or not in their best interest, hanging out with that wrong person or not talking to a teacher and not turning in a test. And what we want to do is help them understand how, we problem solve. And I'll go into a little bit more detail of how we want to cultivate problem solving and have them really, I say, cross training, having them different ways about thinking about one situation. And the big thing to help with neuroplasticity is we need lots of sleep for the kids, tons of sleep. So I know that's sometimes nearly impossible given like the teen schedule, but just so we're really sensitive that is what helps brain growth and emotion regulation quite a bit is sleep. And I think we can all relate. We've all been sleep deprived at some point where when you're sleep deprived, you don't cope well. So what are signs of excessive anxiety and depression? Like I started the presentation, anxiety is really normal. It helps drive us, it helps us figure out things to do. I had a lovely individual that I saw sometime in the last few weeks that I work with, and they gave a great description of anxiety, fear versus anxiety. So great story, well, not great story, but the individual was playing, hanging out, found a flower that they wanted to pick, grabbed the flower. As they grabbed the flower, there was a bee on that flower, right? Again, this is one of my more anxious, this is an anxious patient that I was dealing with. Grabbed the bee, squeezed the bee. Oh no, guess by accident, total accident, got stung, right? Right, oh gosh, on that part of your finger. Went right away, had a fight or flight response. We'll talk about how that's natural. Jumped up, ran to the nurse's office. Great. That is what fear is helpful for, right? Right? So that's fear. Like, that hurts. Let me go get help. We need those feedbacks, right? Then they were sitting in the office and they said to themselves, they had not been stung before. And let's say this individual is about 10 years old and was going, oh goodness, what if I'm allergic to bees? What if I, have a reaction, and what if I die? And the individual is really, we've been working a lot on how do you think it through? And they said, well, they might have an EpiPen, blah, blah, blah. But that was anxiety. Does that make sense? So there's fear and there's normal kind of things that get us going to study for tests or get to work on time. But this was clearly, then the second component was anxiety. And which was a beautiful example of when their anxiety kicked in on top of a normal fear reaction, right? So my first one is the example, worrying before and after events. So bee stung, that's no good. Of course, it's painful, but then they continue to worry, right? Irritability. So, sometimes that can be a symptom of depression, but many times it also can be a sign of anxiety. We don't have a lot of time to go into specific diagnoses. I'll spend a little bit of time in the next slide or so. However, once you have one excessive thing, so if you have excessive anxiety, excessive worry, many times depression can also go hand in hand. So they also can be comorbidity. That's the word we use. Problem being alone, problem sleeping because they're having issues sleeping, falling asleep, staying asleep, or broken sleep because they might be worrying or thinking at night. Being alone refers to kind of worries along the lines of separation anxiety or something bad happening to them or their parent, or their caregiver. They don't like being the center of attention, so having eyes on them, And when I'm speaking of, yes, we all get a little nervous before we might get on stage and perform, but this is like difficulty raising hand in class or standing up to give a minor presentation, or even just to stand on a soccer field where there's a lot of people and they're worried that someone might be paying attention to them. As I said, avoid raising their hands in class, self-conscious excessively, because we're all a little self-conscious, and specifically teens and even the tweens are. Panic, so feeling a lot of physical symptoms. Freezing, so being unable to move or do something when they need to. Freezing kind of alludes to like not being able to raise your hand, or not being able to ask that question, or not being able to say hi to someone that you want to say hi to. Worry, so constant thoughts of concerns and future-oriented thoughts, or worrying about the past, how people saw them or what they said. Butterflies, so feeling uncomfortable in your stomach. Fight or flight response, and that can be when we feel anxious. And back to my B example, there was a flight, the individual ran fine, great, but when it's more consistent and it happens more, that was a natural flight. But let's say they're standing in front of a classroom, running out of the classroom, that would be a more, there's not an inherent danger in that class, unless there was something bad happening, right, or someone was being bullied. But fight or flight response, problems concentrating, and so many more. So let's look at when does it become a disorder versus it's just something that, we kind of all are dealing with, right? So avoidance versus approach, right? So when there's something that we need to do or have to do, that we stay away from doing it, right? So need or want to do versus doing it. And I don't want to go to that party. I feel uncomfortable. I don't want to go back to soccer, even though we know they love that. Oh, not raising their hands or not going to class. Interference. So this is interfering in the things they want or need to do, right? It's interfering in the parents' lives to get their kids to school, or maybe to drop off at aftercare, or interfering in the child's life to not be able to go to a event or something they enjoy. Distress, this is where a lot of parents will start to come to see me, is when they're seeing the child visibly crying, upset, clingy, tantrums, irritable. So you're seeing a real consistent emotional reaction. And transient versus persistent. I mentioned this at the beginning. This is not something where, an event happens and then they kind of forget about it, or it's okay and they move on, because we're not talking in this instance, in this talk, specifically about trauma. Other trauma is very important to take into account. So if there is a specific trauma, I look at this all kind of a bit differently, but it's a persistent worry that goes on at least, for a few weeks, or it's so impairing in the moment, they don't go to school for 3 weeks and that starts it and they won't go through it at all, then that would be something I would maybe consider to hit a disorder level. But knowing that it's really, again, lifetime prevalence of anxiety disorder is about 25%. So 1 in 4 will meet criteria for anxiety disorder at one point in their life. Okay. So what are anxiety disorders? We have separation, and there's a few more, but these are the main ones that you're going to see. We call them the big three. They're the most prevalent. So separation anxiety disorder is a worry about something happening to the child, adolescent, or worrying about something happening to their primary caregiver. And they can worry about both, but many times they'll worry at night. They won't go to parts of the house where they don't feel comfortable. As kids tend to get older, a lot of times they may just say, I just don't feel well. I don't feel comfortable being alone. Sometimes they're able to articulate, I'm worried about a burglar coming in, or I'm worried about having a fire in the house. But many times, there can be specific worries, but sometimes it can just be a feeling. They also may worry just about being separated from their parents. I'm worried my parents, or maybe they don't worry about themselves, but they worry about the parent getting in a car accident, or they worry about the parent getting hurt, or the parent getting a disease. So that's it. And it impedes them. It's not just, we hear about someone passing, and then of course a child might be worried for a few weeks. This is something that's more consistent and more hard to shake, right? These are the kids that are either, they're like mommy's shadow or daddy's shadow, where they're following them around the house, or they're sleeping in the bed and they have a difficulty falling or staying asleep by themselves. A generalized anxiety disorder is the worriers are little old souls, worrying about what either happened in the past and ruminating on that, or worrying about the future. Worries usually change and morph, but they can usually fall into some category of worrying about maybe illness, worrying about performance at school, worrying about, what might happen in the future, worrying about the environment, worrying about finances. It can be any of these things, but things that are excessive and disproportionate for what's going on, right? So again, like I said, if there's a trauma or event, we want to be sensitive to that. And that would be different than generalized anxiety disorder. It'd be normal that they might worry. We have social anxiety disorder. This is the most common and prevalent in adolescence. That's where you're going to see the most of it, but you'll see the underpinnings from a young age many times, where kids have always been inhibited or nervous or scared when meeting new people or talking to new people. Again, this really the focus should be on you are the expert on your child. So you'll know if they're more likely to be anxious in this way. Sometimes they'll just totally keep it to themselves and they're fine at home, but then eventually a teacher lets you know, they don't raise their hand or they don't talk to anyone or they sit by themselves in the playground. If that's by choice that they want to sit by themselves and they're happy and reading their books, more power to them. But if they are, nervous and scared about meeting and talking to new people and they really want that connection, that's another thing to look at, right? So it looks different in every person though. I'll have plenty of theater kids who have also social anxiety disorder, because they'll say to the effect that, well, at least I have a script when I'm running on the theater. It's real life is unscripted. And then they'll have the reverse, where there are kids that are fine with friends, but really do want to perform and don't like all those eyes on them. And so would like to perform. And that's where you see their separation anxiety or their social anxiety disorder. Specific phobias are very common ones that you'll hear about. Throughout, like in the young ages, would more likely be a fear of vomiting, fear of bugs. Those are kind of the two big ones. And for it to meet criteria for a disorder, it has to be impairing. So if it's vomiting, it might be they're afraid of going somewhere where they might vomit. They're worried about vomiting. They have the physical symptoms. They don't want to be at school because what if someone vomits next to them? For the bees or the bugs, they wouldn't want to go outside and do picnics because of this. They wouldn't want to eat outside. And so you have to watch where is it impairing, because we all may have a little bit of some type of fear or thing we don't like, but it has to kind of impact them. And panic disorder is common in the little ones, but more likely you'll see it in the teens. And that is a fear of physical symptoms. Usually there's an initial panic attack that happens. And then from then on, the individual is afraid of having those physical symptoms again. And selective mutism is more you'll see in the little ones, but it is possible to have in middle school and high school, where essentially as it says, selectively mute, where the child will speak fine, loud, no problems at home. But once they're outside, once they're in school, they're pretty much mute. They won't speak to anyone. Many times these kids have either friends to help translate for them or an older sibling to help translate for them. But there's little to no vocalization outside of the home or the trusted people. So what are the physical symptoms of anxiety? And let's get into how do we help our kids in the moment, because I think that's a big part of why you're all here, right? But first, we want to identify. I can't tell you how many kids will come in and say, I don't know what I'm feeling, but I just don't want to do it. And the more you start to lay out, so first, give them a menu. If they, some kids right away will say, my stomach hurts, or I have to go to the bathroom, or I have headaches. And what we want to do is really to start to focus on how exactly, that these symptoms are presenting for each kid, right? So stomach aches, headaches are really common ones. Nausea, feeling like you want to throw up, that's another common one. Also, frequent trips to the bathroom, having to get up in class or in the middle of night. Tightness or pain in the chest would be something that we also might notice. Dizziness or lightheadedness, heart racing. And as we can see with this, and if you just Google the anatomy of fear, you can get this image. And sometimes I like to just give this to my teens or even my younger ones to help them understand they are not crazy. There's nothing wrong with them, but it is their brain misfiring and we need to gain control. So remind your kid, you can't stop it at the moment. Say, stop, don't panic, calm down. No, listen. So let them freak for like 30 seconds or a minute, whatever you can tolerate. Or if you only can tolerate 10 seconds, fine. But then start to be that calming influence, because what's great is it will end. Panic cannot stay up here forever, right? So eventually it will go down. So let them know, relax, try and breathe. If they push back on that, say, okay, I will come back, or let me get you something to ground you. Grounding is a really good tool in those moments where you either pay attention to some sort of sense, right? So you listen, you use your ears to like listen for calming, go outside, listen to birds, have a cold cup of water, have a piece of gum that gets your senses going. If you go Google grounding online, it'll give you a number of different options that are really helpful for kids overall. But be that calming influence, reminding them it ends. And if you can get them to breathe, it can be very helpful. But don't freak if they're like, I can't breathe. Like, don't, if you can get them, and take them a slow breath in, a slow breath out. And the biggest thing is having the longer breath to be the out breath. So, and then tell them, try and slow down your breathing. Then they might breathe in because there might be hyperventilating, breathe out. So really focus on those things versus telling them stop. That makes sense. What's really important for all of us to know also is to change how we respond to anxiety and emotions, right? As the adults, right? Anxiety is normal. So the more we say we don't want it, don't get anxious, try not to get anxious, the more likely we might be to get anxious. That's why I don't want you to say to a kid in a panic or any type of anxious moment, stop, don't do it. It'll get worse and the symptoms will more likely increase. Let them know that is a sign that something's up. Okay, so you're uncomfortable. Your thoughts are bothering you. Let's figure out. Maybe I can help you. Okay. This is normal and will pass, okay? When we think about a scary test or when we think about that kid who bullied us, that's going to make our whole body turn on and feel uncomfortable. So we really want to start to look at what words we use and how we approach anxiety. We don't always have to fix it. That's the big thing for caregivers or mental health professionals or teachers. They want to fix it. They want it to go away. Well, one, if we are going to look at problem solving at some point as something, so yes, maybe we can do something about it, but I would even really encourage, if we can do something about it, let the kid take a real onus, or the adolescent, in what they're doing. You don't always have to fix it, right? So why therapy for anxiety disorders works so well is, one, it's obviously been tested out. The main type of therapy that we know works very well is cognitive behavioral therapy, because it attacks both the behaviors and the thoughts that can increase anxiety. But so if you look at this example here, we want to help them start to learn how to think. Now, we can't, as I said, and you guys will be like, please stop saying this, it's harder to do in the moment, right? We want to do this ahead of time with our child and adolescent, or we want them to do it in therapy when they're calm, right? That's the beauty of therapy, is it's a calm space, right? So you're in an exam and your mind goes blank. So let's role play. Let's think about it. Let's work with them. Okay. Think. The more you think, the more you worry, the more your mind will go blank, right? What are different things that you can say to yourself? Calm down our body. Okay, I'm going to calm down. Take some deep breaths. Smartwatches have become a wonderful, useful tool. They can even remind you to breathe, right? Or a quick meditation. I'm okay now. There's nothing super dangerous happening. Let me breathe. And hopefully your brain will come back online. But it is very true. If kids are reporting they're having a hard time focusing or not doing as well in tests, anxiety can be the reason for that, for sure. Support a new mindset. So it's really important that we understand that anxiety, when an individual is anxious or has an anxiety disorder, their brain becomes very hypervigilant, super aware to negative things, right? We know that from the research that I'm a part of at the National Institute of Mental Health. We're very interested in what we do as fMRI research, where we will have kids participate in different tasks in a scanner. Please excuse me if my cat comes. There he goes. Where they may look at something that's anxiety provoking, or they may hear something that's stressful. And then we look at where their brain lights up, and it does get primed to negative emotions, right? Kids who are higher anxiety, if you compare them to one who are less higher anxiety, there's going to be more negative or amygdala or anxious reactions. So we want to try and get them down to a better, different baseline. So support a new mindset. Their kids will never feel great that they have anxiety. That's what anxiety does. Oh, danger. Feel that they failed, or that they are worried about the future, or that they can't handle things. They feel out of control. So the more we can support the mindset of normalizing anxiety, and also understanding that it's okay to mess up. I think we all make mistakes every day, right? I think we do. Every once in a while, my dad would joke and be like, I make 2 mistakes a year. It's not true. Don't worry. He's not like that. But really, it's true. Like, we have to understand, how do we see mistakes? And so one of my favorite quotes is, experience is the name everyone gives to their mistakes, right? The perfectionist, adolescents, overachievers can go both ways, just so we know. They can work too much and exhaust themselves, but they also can fail or avoid a lot of assignments, because they will feel like if they stay away from it, then it's never really, don't have to really worry about how well they performed, if that makes sense. So as a parent, teacher, caregiver, think about how you can support a different way of thinking. I'm a huge sports fan. This will date me because I love Michael Jordan. But one of my favorite things to do in therapy, and also that's why this sums up what we do in therapy and what in a way you do in cognitive behavioral therapy, is how do we approach our thoughts and how do we approach what's happened to us, right? So the data, what does the data suggest and how do we think about it? So I like this because, yes, I'm sure in a way, and I'm not Jordan was a perfectionist, but how did he approach things and how did he use this kind of worry or perfectionism for good? I've missed more than 9,000 shots in my career. I've lost almost 300 games. 26 times I've been trusted to take the game-winning shot and missed. I've failed over and over again in my life, and that is why I succeed. So if all he did was focus on those 26 times, which would be easy. I think it's easy for the perfectionist to focus on the 26 times, or even that one time they failed, right? But really the approach we need is a little bit different, is how do we think about our failures and our mistakes? Do we learn from them or not? Now, this is not what is happening naturally in an anxious mind. So we want to slow it down and try and help cultivate this approach. So what do you do as a parent and also a professional? What do you do? Do be sensitive. So empathize, empathize, empathize. You'll see I'll go through this a bunch of times longer of how to do that. But essentially it's, I'm listening. I hear you. Let them rant a little bit. It's totally okay. But we don't want them to go down that rabbit hole forever, right? I always let any of my patients come in and talk for a while. Everyone needs to be seen and heard, but how long do we focus on those thoughts, right? And they are valid because they're inside of them, but how do we do that? Educate yourself. Great, you guys are all here. Understand what is anxiety, how does it work, and how we can approach it better in children and adolescents. As I was saying from the beginning, you're more wired for negative. So how do we give a little more positive feedback? How do we focus on things that the individual is doing right? How do we problem solve, right? Instead of seeing that this is a catastrophe or the worst thing possible. Be calm. If you can't be calm, because we all can't be calm all the time, get someone who's calm, grab that neighbor, grab the dog to hang with the kid for a minute while you go calm down. It's okay to not be calm. You don't have to be, the essence of Buddha all the time, but that is very helpful in anxious moments. Be consistent. So whatever we start to ask our children to do, or I'll talk a little bit about how you push your child who's anxious. So if you have a child that has scared to go to school or to separate a certain way, you make sure that whatever you choose, okay, tonight I'm going to sit with you for 2 minutes and then I'm going to leave and I'll be sitting in my room, but you're going to need to fall asleep by yourself. If that's what is decided upon by you and the child, then you need to stick with that for the whole time to really see benefits. And we'll talk about the behavioral, how we push through the behavioral avoidance. Focus on problem solving skills. So there are very few problems we cannot solve, right? Now, solving is a big word, meaning we may not like the solution, but there's something we can do when there's a worry, a stress, and things like that. And we really want to help, again, cultivate the front of their brains, because when fight or flight kicks in, problem solving skills sometimes go out the window. So let's practice that with them. And I'll show you how to do that in a little bit. Don't accommodate too much. So as a caregiver, as a healthcare provider, we want to protect the child and their emotions. Anxiety pulls for you to protect them, but we need to many times back off a little bit, right? Back off the overdoing. Now this can go more either way. And I've definitely seen this in parenting styles where one parent will be like, I'm not even touching it. They can go to bed by themselves, completely leaving them in the room with nothing. And the other one just wants to hold the hand all night long. So that's a whole nother thing that can get in the way of the anxiety going down. It's not what causes the anxiety. The anxiety starts inside, but there are things that a parent or caregiver can do to accommodate it. So doing too much to give into the anxiety when a situation may not be dangerous. Let the teen or kid avoid too much. So not making them go to school, again, sometimes that's hard, especially when they're bigger, or, they want to go to that party, they want to keep playing soccer, but they're saying, no, I don't want to, I'm worried about X, Y, Z. So don't let them avoid too much. This is more important when they are anxious, or if they're in a classroom setting. Don't single them out. Say, oh my God, what's wrong? Why can't you're not raising your hand that much? Those kind of comments that only gives more attention to their anxiety and freaks them out, and you'll get a backfire with that. Excessive reassurance, that means you're not telling your kid it's going to be okay. It's fine. You'll never get XYZ. You'll never get cancer. No one's gonna say I'm never gonna die, but those kind of things, right? Where you're saying it's okay. The child who has anxiety, even adolescent, will call or text to make sure things are okay a lot. You'll notice she'll be like, oh God, I got 10 texts, not just one. It's okay if they said, oh, I missed my homework, Mom, I'm worried, and you provide just a little thing, that's different. But if it's kind of constant and it fits around the same theme, you want to start to learn how you can peel back as their accommodator in a way. Being too directive. So again, it's natural as a healthcare provider, probably as a teacher, as a caregiver, to want to take over and solve the problem for the child. We want to back off and watch the criticism. And it's not uncommon and in a bad thing. Many times it's because just the way we've seen people react to things in the past, or our past parenting experiences, is, why can't you do this? What's wrong with you? And I'll go into exactly what you don't want to say in a minute, detail wise. So as I said, active listening and help them express their feelings. Let's start there. If we can't get them, some parents say, I can't get them to talk. Fine, watch their behaviors and we'll take a more behavioral approach. So look at my behavioral tips that I have in this lecture. Role-playing social situations can be incredibly beneficial. If you have a socially anxious kid or even a worried kid. So what do you do in this situation? Okay, you're at the test, you start to freeze, you don't feel well. Do you just sit there and freeze, or do you want to, okay, let's talk about what you can do. Do you want to go up? Let's practice going up to the teacher and asking them to go get a sip of water, or to take a quick walk around, right? Or let's go figure out, how do you, some kids are worried about asking someone for, a book or going to the library. Let's role play. I'll be the librarian, you be you, and then switch. So they know what to say. Many times kids don't even know what to say. Always discuss social media. More and more data is coming out to suggest how that has an impact on mental health for sure. So make sure you are really approaching and looking at that as something that can contribute to excessive anxiety and help them find better lines and ways to create boundaries with social media. And instruct them that there are other people around them, of course, ones that you feel comfortable with, that they can help with situations. It doesn't fall all on the primary caregiver. It can be a therapist, it can be a counselor at school, it can be their best friend, their best teacher that they like. It can be their music teacher, it can be a pastor. Finding those people that they can talk to. It can even be, we'll talk about peer-to-peer interventions, can be also very strong. It can be a friend, a trusted friend that you guys kind of sanction in a way. So what do we want to do? We're more of a coach than an expert. And I hope I'm coming across that way. I do have expertise in this area, but when I'm sitting one-on-one with a child or working with a family, the family is the one that does have the knowledge. And we want to be more a coach, listen, and figure out, how do we get this thing moving? How do we change behaviors, right? So model behavior and problem solving. If you have a kid who maybe won't even talk to you, just talk out loud if you feel comfortable. I do it all the time. A lot of times when you felt stressed, oh, mommy forgot this. Oh no. Oh, I'd run back and do this, but then I called my friend and they helped out. Like, how do you model feeling anxious and then problem solving? Make sure that your child has one, or two good people to go to, whether it can be grandma and grandpa, but it also can be a best friend, right? Social belonging is very important, and encouraging that is only helpful. Like I said, positive peer support transfer. So letting peers talk, and also letting them go through ideas together and not just you being the expert. And boundaries modeling, more that's with social media. How do you make sure, and how do you show that you're not always stuck on your phone or scrolling through things or on email? So kids are always watching what you're doing. So what do they need to know? What's the approach that's more helpful? You're brave, you're resourceful, you're a thinker, right? You have everything you need inside you to cope with things brilliantly. Because anxiety takes that feeling away. It makes you feel like you can't cope and that the world is falling in, right? Nope, they've got it inside. We just have to figure out how to pull it out of them, right? Don't let your mind tell you that you can't do hard things, because you can. You absolutely can. Now, you don't have to talk like me. You don't have to talk like this, but it gives you the framework of how the approach, the verbal approach, that is much more helpful when dealing with kids with anxiety disorders or any anxiety. So empathy, empathy, empathy. Listen. And I've had plenty of parents who really don't have experience with anxiety, and they look at their kid and they're like, why are you anxious about that? Okay, that's fine. Just listen then. Just listen, accept where they are. So the more we fight and say, oh God, I can't believe you did this. And it's normal for us to have those thoughts or even say them out loud as caregivers. It's normal to get frustrated, but really try your best in the tough moments or even afterwards to impart these kind of feelings to them. Accept them. I see where you are. Let's figure out where we can go. I have faith in you, right? What's going on in your head? So these are ways of just trying to tap into different ways of tapping in to the actual thoughts. But if they're not giving you the thoughts, but you're noticing they're anxious, you can say things like that. I have faith in you. We can do this. Let's figure out how to problem solve, right? What are the different steps we can take? And with problem solving, I usually have them come up with their ideas. Maybe you provide some and you help pick out with pros and cons, what's the best way to approach a problem. We want them to face their fear. Yes. So part of the therapy that I do is called exposure therapy, where we will have them in a safe setting do the things that scare them. Now, don't worry, we never do. If we have a kid who is afraid of heights, we don't drop them out of a plane. It is the things like, okay, maybe you're nervous to ask someone for help. Well, maybe we'll role play with me first. Maybe I'm in a clinic, so I have other people. Maybe you can go ask the nurse for some help. Then maybe you can ask the barista at Starbucks for help, and just kind of working up and having them gradually face their fears. If they're a kid worried about separating, maybe you say, okay, can you go down the basement, pick up those waters and come back up, instead of having them sleep by themselves that one night all by themselves. So that's what I mean by gradually facing their fears. So what not to say, which is really normal. And if you watch TV, people say these things all the time. Don't say, quit being dramatic. You're just being lazy. You need to toughen up. Come on, it's easy. You can do this, right? When are you growing to grow up? You're crazy. Can't you try harder? Pull yourself together. So all those will shut your kid or your partner down, or your friend or your coworker. Try these instead. Again, use your own style, but I'm just trying to give you the theme. I know this is hard for you. Take time. It's okay. How can I help? What do you need right now? Want to talk about it? I see more than just your anxiety. This is what I love about you. And right there's where you can pull that positivity I was talking about, right? This is what I love about you, right? Because when anxiety hits, we think that's the be all end all. Also, really please make sure that we do self-care for ourselves, but also for the kids. And self-care can be whatever fits with that individual. We don't all have to run marathons. We don't all have to do yoga. Again, deep breathing a little bit is just really helpful in those real stressful situations. I think that's something to try on. The best way that I've usually find to approach it with kids is there's a couple of good apps you can look online or on YouTube, some meditations where they can kind of learn deep breathing a fun way, versus most kids don't want to hear me teach them how to deep breathe, I have to say. That what I do encourage, but the rest should be do something every day they enjoy. They like Minecraft, that's fine. Do a little bit of that, as long as it's not just that. But if that's where they find, that's where they chat, fine. Music, sports, clubs, there's so much out there due to, technology. And also now that kind of, for lack of a better word, things have opened up again. There's so many different resources and things that kids can be a part of. Also, you can always tap into your school or local resource center. What are the things that kids are doing their age that they might find fun? So also socialization, again, that can be whatever fits for the kid. Remember that if they just want one or two good friends, fine. If they do want to have a whole group of kids at your house, sounds awful for me, but if that helps with socialization, figuring that out, and support, right? Letting them know that you're always there for them. So this is us. We are, again, located in Bethesda, Maryland. That is where our research studies are. We see kids 8 to 17, not because anxiety does not exist below 8 years old at all, as I showed you in the data, but we do fMRI research. So we tend to have a little bit older of an age range because they get wiggly in the fMRI. So that's us. Those are the numbers to reach us, or the email. We can also just provide referrals, or if you have just questions about anxiety and places we can direct you. We are an institution that is meant to serve the public. And this is if the pediatric studies and adult studies that we will see at NIMH at the Bethesda campus. And then also, if you have any questions, again, those numbers are a good one to call. And lastly, here are some resources where obviously I'm giving this talk right now. They have a wonderful amount of resources. These are more specific to anxiety and anxiety disorders and also ADHD. I didn't talk too much about attention deficit hyperactivity disorder. Pretty much anything by Barkley is really good. But just to highlight that they can go comorbid, again, it can stick with an anxiety disorder as well. But these are really good. And one place, this Rapé book, An Anxious Child, a Step-by-Step Guide for Parents, is just a really good place to start. I say many times, start there. If that doesn't give you any traction, maybe it's time for you to find a professional or talk to the school and see how they can help. So I am going to close down my presentation, I guess, and then give you the opportunity to chat about this. I like to keep this pretty informal, so just bear with me as I shut this down and we can start to see if there's been questions in the chat. All right, I'll just do this stop share for now. And then if anyone needs to see parts of the presentation too, I'm happy to bring that up. So
there haven't been any questions, just a conversation about some strategies and tools that folks are using for their kids. There was an individual who shared about their daughter staying home from school today, who woke up saying that she felt dizzy. You know, some of the things that you were talking about earlier with some of those symptoms that we might see with anxiety, you know, and then just some sharing of resources. Does anyone have any questions or comments about what we've heard today from Dr. Berman or anything that we'd like to discuss? We have about 10 minutes left in our time together, so we'd love to utilize that time well. Feel free to come on to camera and ask questions, or we can utilize the chat. I have a question that might spark some conversation. What are some good suggestions you might have for advocating for your child at school if they're struggling with their anxiety in the school setting? What are some steps a parent or caregiver could take to support them at school?
right. So I think, in the school, it looks different for every kid. And I can't tell you how many times I've, contacted a teacher and they'll be like, they look fine in the school. And that's because it's an internalizing disorder, right? Like we were saying, the kids will want to hold it together more in the school. You will see those kids, of course, who are crying and upset and overwhelmed, when they initially separate or when they have thoughts that are scaring them. But a lot of times those kids hold it together at school. But the problem is then they get distracted and it's hard for them to focus, right? So I think what's most important is talking to the kid ahead of time of what it is that they may need, right? So if it's that they're having difficulty, if they're feeling nauseous, if there's a lot of physical symptoms, right? So are we tapping into physical symptoms? What can we do? Can they get up and get some water, take a walk? Can they bring something to school that soothes them, right? So nowadays fidgets are pretty well accepted across the board, right? So anything they can play with or do or handle, also knowing who is that trusted adult they can go to. Many times just having the kid know, okay, when you're feeling nervous, if there's a thought that's getting stuck, you can always go to the counselor and let the counselor know. If they don't feel comfortable with the counselor, it can be the lady in the front office. I can't tell you how many my teen kids love to chat with the lady in the front office. That's fine. Just going there, expressing themselves. And what's great is in the school setting, most people are there to really help your kids. So they don't have to be experts. It's just to let them listen and get these things out. They don't have to reframe the thoughts. Like I was saying, we have to focus on how do we think about things. I think those are other things that sometimes my kids will bring cards of how to cope, right? And I saw that kind of in the chat. So laminate a little card or have something for the kid to remind themselves of the thoughts. I saw people talking about phones. So for the older kids, taking screenshots of either motivational thoughts or feelings or an image of, your cat or dog, like sometimes that can help. Knowing that, I think that's really important for us to know, that just making sure there is a number of tools that the kid knows that's specific to the child, obviously. And also, again, knowing that they can most kids with anxiety feel like they're stuck, right? And they feel overwhelmed. And so they're like, well, what if I cry in this classroom and then I can't go home? Well, what if I do this? What if I feel this? What if? So when you hear what ifs, you know that's the anxiety talking in general. And so we want them to know, where do they go and who do they see or what do they do? And if they just have that like structure of knowing, a lot of people take that anxiety down by quite a bit, knowing and having a plan.
Thank you. Another question here is, what types of items are useful for grounding?
So the way I tap into that is really figuring out what the child, adolescent, or even adult finds more, pleasurable. I'll give you a couple examples, right? So for a lot of patients that get warm when they're anxious, having like an ice pack is a super important thing. They'll get that, they'll take it, it'll ground them. They like more that tactile and that touch, right? I have some kids though who are very verbal and stuck in their head. And I have to say, he was one of my favorite little guys, had separation anxiety disorder. And he really was not someone who wanted to grab an ice pack. He also had sensory issues. So that was an issue, right? That we could not kind of sound or taste or things like that was tricky for him, but he loved geography. So for grounding, it can just be like tapping into that mind. So we would start, I don't know if you've ever heard it, where you give like one city, you name a city, and then what the last letter is, you give to the next one. So just having him, grounding can be something that you do just internally for your brain. But you always tap into those five senses. A lot of adolescents love gum. So either really spicy gum, really calm, like really like fruity gum. So getting something that they can taste. Cold water is always a good one, or tea that they can smell and drink. But it's kids, so I feel like gum is a better one to go with than tea. But you get some of those like kind of old souls that will dig that. And like I said, blankets, textures. I remember I had one big, football player once who just like his jersey, that's what he would grab. So you really have to listen and know that child and anything that'll tap into the senses. But the ice packs are a really good one. And then like oils, like kind of, what do you call those, like scented oils or things like that, they can just rub on and smell, like the lavender or eucalyptus. Those are really good. So just, go, Googling it, but just find out what sense you kind of rely on. And music is a great one as well for that.
Any other thoughts or questions for anybody, from anyone? All right. Well, thank you, Dr. Berman, for being here today. Thank you for your time. As a reminder, we will be emailing out the recording to everybody in case you missed something or just want to share it with someone that you know. We appreciate you and all of this information. It was very helpful. And I know that folks got a lot from it. So thank you everyone for being here. We will have a social next month, and you can check out our website for more information on that. Thanks so much, everybody.